Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.
Hi, my name's Lynn Nesland, and I'm a MNSure navigator at MAHUBE-OTWA Community Action. What is MNSure, you may ask? It's an online application system used to determine what type of insurance households are eligible for if they do not have insurance offered through their employer. By inputting your household demographics, such as how many people live in your home, their ages, and their income, it allows the program to determine if someone's eligible for medical assistance, Minnesota Care, or a qualified health plan. Medical assistance is a no to low cost insurance offered to low to moderate income families and is managed by your local county offices. Minnesota Care is a premium-based insurance that has an amount that you pay each month that is based on your income. Sometimes that amount is as low as $3 and $4, but then you also have co-pays for your doctor visits and your prescription costs. The third option is a qualified health plan. These are more like employer-sponsored coverage where they have a premium each month. There's deductibles that you have to meet, and there may be co-pays, again, for your doctor visits and your prescriptions. Navigators are available to help you with the application. However, if a qualified health plan is something that you are eligible for, your community has local brokers that are also contracted with MNSure to help you decide which plan is best for you and your family. From November 1st through December 22nd, individuals can make changes to their qualified health plan and apply for tax credits towards their monthly premium payments. This is considered MNSure's open enrollment period. Outside of this window, you can only make changes or get tax credits if you have a life event change, such as the birth of a child, a divorce, or you lose your job and no longer have employer-sponsored coverage. Households can apply through MNSure any time of the year and be eligible for medical assistance or Minnesota Care. Navigators are typically available by appointment. However, the MAHUBE-OTWA offices are closed, and appointments are all done over the phone or over the internet. To reach a navigator, you can call our office at 218-847-1385, and they'll be able to return your call and answer any questions or help with application assistance. Questions can also be answered by going to the MNSure website at www.MNSure.org, MNSure.org. With the current situations with COVID-19, many households are experiencing reductions in income, layoffs because of their employers not having the volume of work needed, and they wonder what happens to my health insurance. If you have questions, there are resources as stated at MNSure.org, which can help you look at some of the options. Our navigators are very versed in understanding with complex households, maybe one spouse is self-employed, one has employer-sponsored coverage, multiple children, even blended families can really have questionable who covers health insurance, who doesn't cover health insurance. So in situations with blended households, it's really good to talk with a navigator or a local broker about your situation so they can help you look at and make sure that you're not using what little, sometimes as we go on unemployment, we're stretching every dollar. Should we pay the mortgage? Should we pay for health insurance? And in those cases, our navigators can look at and help you decide, these options are available for you. So maybe you only have to have yourself and your spouse covered, and your children can be covered under medical assistance due to the reduction in income. One other thing to note is doing an application online with our navigators. They're processed within 24 hours. Sometimes instantly what your family's potential eligibility for and where your information will be transferred to. If the system says you're eligible for medical assistance, it's an automatic transfer to the county of residence, and then the county decides if they need any follow-up documentation in relation to your income. Assets are not something that's considered when looking at health insurance options. It's household incomes and household demographics as far as the number of people in your home and then also some reference to how many dependents you claim on your taxes. So it's much quicker to get an application done online than waiting for the paper process. And also trying to get into your county offices can be difficult at this time because of COVID-19. Any additional questions, feel free to call our navigators again at 218-847-1385.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.